Hello and welcome to Global Healthcast, brought to you by Global Healthcast. In our special edition today, we talk about life course immunization, and we talk about the country vaccination score, and specifically on Cameroon, a country in Africa. I am Joe Schmitt, and I'm very happy today. We have two special guests on our topics, which is Dr. Daphne Holt and Dr. Yauba Saidu. Welcome to both of you. And let's start right away. I have a question to Daphne Holt, our first guest. The question is, what is the Coalition for Life Course Immunization that you are chairing? What is it all about?
Thank you, Joe. CLCI, as you can see on the slide, is a diverse network of individuals and associations. And we represent across the piece, essentially, public health, patients, academics, and healthcare professionals across Europe. We're committed to preventing infectious disease over the life course. And we concentrate our audience is our peers and policymakers. And vaccinations are not just for children. We believe that vaccinations are an important part of daily life at all ages and stages.
That is a very important topic because the past history is always about pediatric vaccination. Actually, pediatric vaccination is the only field that I remember. There was always a pediatric vaccine before there was an adult vaccine. So it's the other way around in pharmacology. So my question then is, why is life course immunization relevant? What is your goal here? Why do we need this approach?
Okay, so before we talk about why we need it, let's just define what it is. We're all familiar, as you just said, with vaccinations for children. So life course vaccination means thinking outside of that box. We have vaccinations for pediatrics, for adolescents, for adults, and for older adults, and we should be using all of them as and when they're needed at every age and stage of life. And we should be using them in a systematic manner. So why is it important? Well, if we needed an illustration that vaccination is not just for children, then COVID-19 has provided us with that. Vaccination across the life course saved millions of lives, an estimated 20 million worldwide in the first year, I believe. So now we have to establish that mindset for routine vaccination. One of the first messages of the pandemic was, you need to get vaccinated yourself to protect others. But we also need to understand why it's important to protect our own health. At whatever age or stage of life, we need to be protected with vaccines that are available. And influenza is a very easy example. Adult vaccination makes individual economic as well as healthcare sense. It also makes sense at national and international level. Many governments now are wanting to make changes to the retirement age in line with the changing demographics. And indeed, many people want to work longer or have to work longer. And for that, we need to stay healthy and protected from vaccine preventable infectious disease. Also, if we do have a longer retirement, then we need to be healthy to enjoy it. And I'd like to add another point here, actually, which is at the other end of the spectrum. Did you know that 25 million children worldwide missed out on their routine vaccinations in 2021? 25 million children. That's quite shocking. Some member states of the European Union disrupted their programs just at a time when it was important to protect against infectious diseases. And now UNICEF and the WHO have issued joint statements indicating that member states should recover these programs as soon as possible.
That is an important point. We have to maintain vaccination systems throughout pandemics, throughout emergencies, whatever. And I think you have very good arguments why we should be vaccinated throughout life. The question then comes, what do you need to establish the concept of life course immunization? What is needed there?
Okay. We need a change of narrative. I've already alluded to that. And for that to happen, we need 5 things. We need comprehensive programs to establish adult vaccination routinely. But as I think we'll hear a little bit later, the work that's been done by the CVS working program, having a plan does not mean having a program. To turn that plan into a program, it needs to have clear and measurable goals that can be implemented and then evaluated. After evaluation, adjustments can be made, and then re-implementation and evaluation until the goals are met. Only then will we be able to see what is successful in driving vaccination uptake in the population across the piece, across the board. Secondly, we need the infrastructure to do this. First, surveillance, which means collecting comprehensive data. And we need more opportunities for access to vaccination for working adults. So empowering pharmacists to vaccinate. This was a game changer during the pandemic, especially here in France, which is where I'm based, and for older adults also. The third point, we need communication campaigns for healthcare professionals so that they know what to recommend to their patients and how to give that recommendation. The most trusted bearer of messages is the family doctor, and we should be giving them the tools that they need. Our fourth point, we need communication campaigns for the public, so they need to know what to ask for. And I have left the most important point until the last. All of this costs money. So we need political will to do this at national and international level. Few European countries spend more than 0.5% of their healthcare budgets on immunisation. So we need politicians on board at every level in order for that funding to be put in place.
That is very important. I think the money is a good investment, because for all vaccines, routine vaccines at least, it has been shown that the more you invest, the more you produce health. And this information is not out there. Saving money is an important issue, and you can save money by good vaccination programs. I think political will is really the most important point here. But let me ask you one last question. This is all a lot of theory. What do you ask specifically? What do you think should be done specifically to make life course vaccination happen? How would it look like?
Okay, well, this I've alluded to this several times now. The vaccines are available, and I've talked about every age and stage of life. So we should not forget maternal immunisation. And you can see that we've got 3 there that are recommended but not licensed necessarily. Infants and toddlers, once again, a whole list. And there are 1 or 2 countries in Europe where the infant and the school age vaccinations are mandatory. So France, I believe, has 11 or 12 vaccinations that are mandatory for school age children. Adults, the COVID boosters, obviously. And just recently, I've had a Tdap vaccination, the influenza vaccination. The notice came through my door yesterday to have this, and we can now have it alongside the COVID booster vaccination. HPV, obviously, and HPV also important for adolescents. Workplace vaccinations. This is something that really interests me because I spoke about access. And if we're going to get healthy adults to have vaccinations, then vaccinating in the workplace actually is a really good way of going about it. So we need to get employers on board to be able to offer this. And then we have the 65-year-olds. So we have the boosters again. We have influenza, herpes zoster, and the meningitis vaccines. And actually, it's the meningitis vaccines where I came into this area, because the Coalition for Life Course Immunisation was first mooted when I was working in the meningitis area, and the adults actually required meningitis vaccines as well as the children. So thinking outside of the box is really what we need to do, and this is a very nice illustration of that.
I think, Daphne, most adults would be very surprised to see this slide and how many vaccines are available for their protection already. And I guess most adults would be surprised which ones they are missing, right? So I think this is really important. And I think this was really a great review of what is available and what should be done and what can be done. Thank you very much. And I guess you already mentioned that life course immunization requires the systems to be there, requires the ability of a country to make life course vaccination happen. And for that purpose, we have here today Dr. Saidu from Cameroon. Yauba, we have worked together on the country vaccination score, CVS. And there we evaluated by now 42 countries with the questions if they have vaccination goals, plans, implementation, and evaluation. And specifically, do countries know which vaccines they want to implement in the future? What are the vaccination targets they have today? Do they have one plan? Do they have a continuous pipeline review? Do they have implementation and evaluation? And Yoba, what I would like to do with you now is to look into Cameroon. What you see here is the CVS of selected countries, and actually Cameroon has 7 out of 8 points. And Germany, by the way, only has 1 out of 8 points, as there is only a vaccination plan, but all other items are missing. So let's go one by one. Yauba, future needs and defined targets. Can you embark a little bit on the situation in Cameroon?
Okay, thank you very much, Joe. It's actually a pleasure to be in this forum and also to share my perspective on why Cameroon had the high score compared to other developed countries. Yes, in terms of future plans, I think the country has a national immunization strategy, which formerly was referred to as a comprehensive multi-year plan that kind of highlights or outlines the vaccines that the country plans to introduce in the near future. So I think in the current plan, the country plans to introduce a couple of vaccines, including the birth dose of hepatitis, and also vaccine against meningitis and the newly recommended malaria vaccines.
Okay, that is, I forgot the brand name of this, but it has a Rix in the end, if I remember correctly, right? Yeah,
Correct,
I forgot the name. Yeah, very good. That's very interesting. And you do have defined targets with a deadline, like I guess measles elimination by whatever, right?
Yes, absolutely. I think there are defined timelines and also targets, and these the targets and timelines that they are very well aligned with the global target. So there is a target and timeline for measles elimination, as well as elimination or eradication of poliomyelitis. And I think I remember that there is also a timeline for eliminating neonatal and maternal tetanus.
Great. One NITAC plan would be the next item. Who is making the plan?
That is a good question. I think the plan is being made by the Ministry of Public Health with the Department of Vaccination is actually in charge of writing the plan, and building this plan actually involves a lot of collaboration between the government and other stakeholders, notably WHO, UNICEF, and other extended partners like the Clinton Health Access Initiative, JSI, and so on. And then I think another important player in the space is the civil society.
And is the plan regularly updated? How often do they meet? Would you know?
So I think the plan is usually established for a period of 5 years. And each year, what usually happens is that the specific deliverables or activities for that year are kind of extracted and populated in what they call an annual work plan, which is then transformed into monthly and weekly work plans.
And I guess since this is government organized, there are clear responsibilities and accountabilities, and people have to make sure that things happen. Is that correct?
Yeah, yes, that is correct. I think if we take, for instance, the expanded program on immunization, I think there is a body, the interagency coordinating committee that kinds of oversees the activities of the immunization program. And I think annually we have about 4 meetings of the interagency coordinating committee. And one of their key responsibilities is to, first of all, validate the annual plan, and secondly, to review the annual plan on a quarterly basis to ensure that the activities enlisted in the plan are being implemented, and also to troubleshoot and course correct.
Another important item that Daphne already mentioned is you need political will, certainly to get the money, but also to think about vaccination.
Yeah, yes, absolutely. I think there is a very good system for informing the country or the population about vaccinations and also about campaigns. And I think whenever the country plans to organize a campaign, I think the EPI and also the EPI and the stakeholders, they will first of all develop communication and advocacy plans and then materials which they will use to disseminate using various channels. And most of the channels that are being used are usually the national TV, radio, and now social media. So I think the public is usually well informed by the government about upcoming campaigns.
Yeah. Then the next question would be vaccine uptake. I'm very amazed that there is one point for having a vaccine uptake. In Germany, we don't have good data on vaccine uptake. For school entry is 5 years too late, right? You want it or 3 years late. You want to have it by the time they go to kindergarten. You want to know, is everybody vaccinated? Are you sure you have good vaccine uptake data, and how do you get them?
I think this is an important question, and it's a kind of question that really needs to be viewed with caution. So the EPI has a system for collecting data. So in general, data being recorded on vaccination registers or tally sheets when the shots have been administered, and then these are consolidated at the end of the month, populated in what they call the monthly progress report, and sent to national level for consolidation. But the challenge here is actually twofold. So there is usually that problem of timeliness of the data. The data do not reach the central level on time for timely decision making, and there is also a problem with completeness, because most of the time, not all facilities submit their data on time. And again, other issues relate to the quality of the data. But I think despite all these challenges, I think at the end of the year, the EPI will kind of invest a lot of effort to sensitize health facilities to send their data, invest efforts to clean the data, and then produce the annual coverage for the individual antigens.
So I guess the expanded program immunization, the API, this is the organization or the system that helps you come up with the data and supports the vaccination system and makes it happen. And that may be the trick, right? You have someone from outside giving you money, supporting you, and trying to make it happen so that you can be successful.
Absolutely.
And, yeah, I guess for France and Germany, this would be unacceptable if somebody comes in and would tell us what we need to do to be successful, right? And that may be a disadvantage even, right? If the European Union would say something, we don't like it, right? Anyway, the last point, burden of disease. I mean, you do have the vaccine uptake data. Why not get burden of disease data? I guess I know the answer, but maybe you can explain it.
No, it's actually good that you know the answer, because myself, I'm actually struggling to actually understand why why this is a problem. I think the underlying reason here is that the systems or infrastructure to collect and transmit the burden of disease data is really weak. So I think the government has a number of ministerial departments that are in charge of this, but I think these departments, they do face significant challenges, particularly that related to funding.
I think the explanation is on the next slide. There is no good burden of disease data because you only have 2,400 physicians for a population of 27 million. Germany has 3 times the population, but 166.7 times more physicians, 400,000. And if you want a diagnosis, you need to do a testing. And your annual healthcare expenditures is 53 euros. This is less for one PCR test for COVID. One PCR test over here usually runs around 100 euros, maybe a little bit less now. But you don't waste the money on diagnostics, you vaccinate. And that is, if you have good vaccine uptake, you can skip the diagnostics and burden of disease. You know the vaccines are working, so you don't need to worry much about the effect that you have. I guess that is my explanation. But maybe, Yauba, last question is, any explanations why, look, Germany, I mentioned already, with 3 times the population, 166 times as many physicians, and the number of GPs there is a 100-fold difference. Why do you think that vaccination is so successful and so successfully managed in your country versus many high-income countries?
Yeah, I think this is an important question, and what comes to mind is the support that the government of Cameroon receives from either Gavi or other bilateral or multilateral donors. So I think an organization like Gavi kinds of inject a lot of funds into the immunization program, which enables the program to manage better, which enables the program to procure vaccines, distribute a critical role. I think most often the expanded program of immunization is being funded to a greater extent by external partners like Gavi, and most often the program receive programmatic support in terms of technical assistance from other organizations like WHO and also the Clinton Health Access Initiative. So I think that can actually explain why the score is somewhat higher compared to what you find in Germany. So just to kind of summarize, I think the program is mostly funded by external parties, Gavi and WHO and other external partners.
Great point. I think more high-income countries could get a better score if they would be better managed, if there would be, and I come back to Daphne's presentation, if there would be political will. And I think there would be a huge return on investment. And as we're struggling today with financial issues everywhere on the globe for various reasons, particularly with rising healthcare costs, I think it is a very good point. We have a very good point and a very good argument to improve vaccination throughout life and to improve the infrastructure to get it done. Daphne, any question from your side or any point you want to make with regard to Yauba's arguments?
Yes, I would like to ask a question, if I may. Yobi, you mentioned that your platform for communications to the public was TV, radio, and social media. So I've got kind of two parts to this question. Do you do any community communication, as it were, actually on the ground, other than these? And thinking about social media, well, thinking about all of the platforms, actually, do you have a great deal of vaccine hesitancy in your country?
Thank you very much. I think those are very important questions. I think talking about disseminating information and within the community, I think there are kind of very good community structures, particularly in remote villages or rural areas. I think most often it's kind of easy to get information disseminated within a community through their community leader, either a community leader or an authority in a church or a Muslim cleric and so on. So those type of channels kind of work very well. And also at the community level, I think many communities do have local radios, which are kind of used to disseminate information about vaccination. And another important point, something that we frequently see is the use of what we call town criers. So these are people in the community who are well known and who move around informing the entire community about vaccination. It's kind of interesting to see them blowing the trumpet and informing people about campaigns or other health interventions that are being planned to be implemented in the community. So the second question kind of relates to social media, right?
Mm-hmm.
So
vaccine hesitancy.
Yeah. Okay, yeah, vaccine hesitancy. I think this is also a big problem. We have seen that particularly in 2021 and also 2022, and most of the information that is being kind of spread via the social media kinds of have an influence on the ability of people to get vaccinations. So I think I remember when we were preparing to introduce COVID vaccine, there was this unfortunate incident that happened in Europe where physicians or the media kind of communicated the relationship between vaccine uptake and also blood clot. And I think that sort of information circulated widely on social media, which kind of affected people's ability to get vaccinated or to solicit for that vaccine. So we have seen that for COVID, and we have also seen that for a vaccine like HPV. In particular for HPV, it's kind of interesting to highlight that there was this French professor, I've forgotten his name, but he did produce a video and indicating how bad the HPV vaccine is. And this video actually went viral, so causing people or families to be reluctant to get their girl children vaccinated against human papillomavirus. So I think the social media plays a very important role in fueling vaccine hesitancy in Cameroon. So I think the EPI and the Minister of Public Health have recognized this, and that is why they have set up social media channels, Facebook, WhatsApp, YouTube, and so on, to educate the public on the importance and benefit of vaccination, and also to
very important point that you raised. Vaccination scare in one country may have impact on other countries. And that is something actually that would be a new broadcast at a later point, how we can make sure that there is no overflow of wrong information to other countries. For the sake of time, I have to stop here. We have to stop our discussion, but this was really, really great. Thank you, both of you, Dr. Saidu, Dr. Holt in Cameroon and in France. And let me summarize the main messages. The Coalition for Life Course Immunization is there to have an impact for life course immunization. And the need is to get the message out there to everybody to get vaccinated throughout life, not only for children. And the second is we need the structure, the money, the political will, you name it, to make it happen, because in the end, this saves us money, and more than that, it saves our health and lives. And finally, the country vaccination score is one way to evaluate how well a country is running vaccination programs. And we compared a low middle income country, Cameroon, with a high income country, which is Germany. And there's a huge difference, and the low income country is performing much better. So we can learn a lot from Cameroon. I'm happy to say this, Yahuba. Thanks to both of you for joining us today. To our audience, please write us which topics you would want to discuss next week. You can download the PDFs of our slides in the show notes. Also, please like, share, or leave your comments below. Thanks for listening. I am Joe Schmitt. Goodbye.